One of the highest paid skilled professions in Alabama is not what you might think. It's physical therapy assistants.
They make about $60,000 a year. And tonight's Skill to Work story, WAAY 31's Will Robinson Smith takes a closer look at why the demand is so high and why people are now lining up to join the profession.
Micah Jenkins is no stranger to pain. The mother of two has dealt with chronic back pain for a decade, turning to exercise like CrossFit to help. But recently, it's been getting worse.
I was waking up every single day in back pain. Like, I bought 2-3 different mattresses. That's how bad it was.
After trying several different treatments, a friend at a CrossFit gym suggested physical therapy, and
my back's not hurting in the morning at all anymore. And so it's really encouraging because it's only been a few weeks. And so I'm really excited to see how it gets even better.
You probably are getting a stretch on that left outer hip.
Jay Shug is a physical therapy assistant at Austin Physical Therapy in Huntsville and is the man behind her treatment. He's worked as a PTA since he graduated from Wallace State Community College back in 1998. He says the market was fairly flooded when he began, but it's starting to level out now.
The cool thing is that you can start in one area and gain some experience, and then you can actually transfer into a different area using your same degree, gain some different experience.
In addition to Wallace State, which is the oldest PTA program in Alabama, Calhoun Community College started its own program back in 2009. Both programs boast a 100% job placement rate for their graduates. Beyond helping his patients with things like CrossFit and quality of life, Shug says it's important to invest in future PTAs on the education side by offering his expertise to help them transition into the professional world. Shug periodically lectures at both Wallace and Calhoun and serves on Calhoun's PTA Program Advisory Board. First-year PTA student Christina Lewis says unique learning opportunities like this are especially valuable.
To have someone come in from outside of our bubble and to teach us things from their perspective, like Jay today is going to be talking to us about kind of a little bit of a twist on the things that we're learning, because that's how he's learned that it works best in his clinic and with his patients. You can't put money on it.
Back at the clinic, Shug says because of the aging population, the flexibility of work settings, and a desire to move away from some pain medication like opioids, there's a lot of growth potential for PTAs.
Sky's the limit, really, in my opinion, as far as what we can do in this field. Really, we have a lot of opportunity.
Reporting in Huntsville, Will Robinson Smith, WAAY 31 News.